All right. And we're starting with the Board of Health, right? Okay. All right, we'll convene the meeting of the Dubuque County Board of Supervisors and the Dubuque County Board of Health, Wednesday, April 8th, 2020, 9 a.m. Under this mask, I'm Dave Baker, the chairperson of the Dubuque County Board of Supervisors. Under the agenda, item number 1, update from the Board of Health. At this time, I'm going to turn it over to Tom Beschen and let Tom handle the Board of Health portion of the meeting.
Okay. Thank you, Dave. I just wonder, looking at the agenda and looking at the second item on the agenda, the update from the emergency response team, I'm wondering if there may be some redundancy in our agenda with their update, and if it would be acceptable, I'd propose that they provide their update first, and then we can address any unanswered questions.
A good point from a good chairman. We'll do just that at your recommendation. So we'll skip over item 1 on the agenda, which has several items in it, and we'll go to item number 2, update from the County Emergency Response Team on COVID-19, and we will have either Patrice Lambert and or Tom Berger. It sounds like Patrice might be ready to hit the ground running here. So Patrice, we'll turn it over to you.
Okay, good morning, everyone. Can you hear me?
I can hear you.
Okay. I know Tom Berger had another conflict this morning, so I think he will be joining us when he does have a free time. But I can start with the update on our county emergency response team on the COVID-19. I will identify right up front, so if I do refer to people as saying we or whatever the case may be, I am referring to the Dubuque County Public Health Incident Management Team. And again, I'll just quickly identify those people. We have Stacy Killian, the director of the Visiting Nurse Association, Mary Rose Corrigan, who is the City of Dubuque Public Health Specialist, Tom Berger, who is the Dubuque County Emergency Management Agency, our EMA, and myself. And we meet on a daily basis, and then we also do meet once a week with both hospitals to discuss issues related to the COVID. And we're currently and continuously coordinating our response efforts in conjunction with the Iowa Department of Public Health and with guidance from the CDC, and that is via weekly webinars. And then IDPH, we have direct contact with our regional epidemiologist, and we talk to IDPH at least once a day. So again, we feel as though our communication lines are open and working. So with that, I'm just going to give you a quick update on our numbers. As you probably did hear from the governor yesterday, we now have confirmed cases of 1,048 in the state of Iowa. And in Dubuque, we are still currently at 28 positive. And then also as of last evening, actually early this morning too, the numbers have not changed as of yet. There have been 11,670 negative COVID tests in the state of Iowa. And just a reminder again, the governor of the state of Iowa has changed her press conferences to 11 o'clock Monday through Friday. and she will announce if she's going to do any over the weekend, and that is in conjunction with the Iowa Department of Public Health, and that is usually when they release any of the updated positives, negatives, and outbreaks, as well as any deaths in the state of Iowa. But we just encourage people to go to the Iowa Department of Public Health website. It has all of the up-to-date information, and it has excellent resources for a variety of establishments, such as food establishments, healthcare, public health, long-term care, prevention, schools, fact sheets for the public. So again, it's just an excellent resource. And also we encourage people to go to the CDC, as they have wonderful resources available too. We continue to encourage people, if they see something on social media, if they're questioning whether it's true or false, please go to a reliable, factual site to look for that information, such as IDPH and the CDC. So with that, I don't know if Tom Berger is on yet or not. I don't think he is. So do you want me, Tom, Beshen, just to go right into our cloth mask recommendations?
Patrice, I have a question for you. This is Dave Baker.
Sure.
Okay, I follow obviously the governor's news conferences, and Dr. Pedretti, I believe is her name, stated yesterday that there were 3 nursing homes in the state that have positive cases of the COVID-19 virus, but that, and none of those were in Dubuque County. And I just don't think that's true. And I have some firsthand knowledge of a Dubuque County case. So are they giving us the whole story? Why would they leave that out? Or is she, I would think as the head of the IDPH, she would be in the loop on this. So can you explain that?
Sure. And I will tell you right up front, we cannot confirm any cases, period. I mean, as far as Stacy, Mary Rose, Tom, or myself, I want everyone to know that if someone were to question us about a positive case, we are legally bound not to provide any information. So with that,
Patrice, I want to make sure that we're getting the truth.
Sure. And I will talk in general.
Yeah.
I will talk in general with the long-term care facilities. The state of Iowa does consider an outbreak of 3 or more people in a home, whether that be a worker or a resident. So the 3 that have been identified have hit that criteria. And when they also look at outbreaks, they look at the time frame. If someone, whether it be a caregiver, a worker, a resident, if they were positive 2 weeks ago or even 3 weeks ago, but they are not currently in isolation, they are considered recovered, they are not counted into that number of 3 or more. The outbreak criteria, which you can find on the Iowa Department of Public Health, if you go to that site, if you look at the left-hand side of that board, they have all kinds of information on the long-term care, and they will show you that they have a checklist that the long-term care facilities do have to go through regarding any outbreaks. They also have had new guidelines for the long-term care workers, and I'm just trying to pull that one up so I can share that with you. Let's see. Okay, I've got the checklist for the long-term care facilities. If you want to even look at that sometime, you don't have to do that, but it's immediately send home any employee that becomes sick, isolate all the symptomatic residents in single rooms. I mean, it does give you a step-by-step item. So anyway, back to your question, Dave, when you are questioning whether that was valid information that was given yesterday, that was based on the criteria that they are looking at 3 or more to be considered an outbreak, and that being a worker as well as a resident. And they all have to be the positives at the same time. They can't be a positive that has recovered a month ago. They will look into that, but that's not part of the criteria for doing the definition of an outbreak. So does that help? So yes, I'm trying to say that yes, the information that was given out yesterday on the governor's conference by Sarah from the Iowa Department of Public Health, as well as Dr. Padati, that is accurate information.
Yeah,
does that help, Dave?
The rule, it does. Thank you for that. And I was aware that an outbreak is defined as 3, but that was either not mentioned by the folks doing the press conference or the TV station didn't put it in. So again, I think it's downplaying what's going on. I think people have the right to know, especially if we have loved ones in these nursing homes and we have family and friends that work there. So I think having more information is better. Apparently, the experts disagree with that. But I'll let you go on with your presentation.
No, and I can also share, I'm thinking that you're thinking the experts at the Iowa Department of Public Health, they have told us whenever there is even one initial positive in any nursing home in the state of Iowa, whether it be a caregiver or a resident, they will make that first call to that nursing home. And then what they will do is work with the administrator of that nursing home to do all of the preventive steps or communication or anything else that might be needed. And likewise, even if they do not have a positive case, the Iowa Department of Public Health are having people check on long-term care as well as the hospitals now on a daily basis, checking in to see are they PPE, are they adequately supplied, do they need any assistance. So the Iowa Department of Public Health is taking that extra step for the hospitals and for the long-term care. And again, if there's any positive, whether it be a care worker or a long-term care resident, Iowa Department of Public Health does make contact with that nursing home or assisted living or long-term care facility. So there are additional steps that are also being done. Does that help, Dave?
I appreciate the information.
Sure. Well, thank you for the questions. Okay. So do you want me to, Tom Beschen, do you want me to go right into the cloth mask recommendations then?
Yes, why don't you?
Tom, this is Supervisor Jay Wickman.
Oh, I'm sorry.
Can you confirm who's on the phone or Zoom with from the Board of Health? Make sure we have a quorum and introduce those Board of Health members.
Yes, from what I can see, Jay, we have myself, Diane Heiken, Tim Daly, Suzanne Stroud, and Todd Lang. So we have a quorum.
I'm on too, Tom.
Diane Freiberger is also on.
Wonderful, thank you.
Okay.
Okay, as chair, I'm going to defer to Tom Beschen, chair of the Dubuque County Board of Health.
Okay. Then let's talk about the cloth mask recommendation. We have had some guidance from IDPH on that. So Patrice, I'll let you explain the guidance and then the Board of Health can ask questions.
Absolutely. And again, we just ask that you go to the CDC website or the Iowa Department of Public Health website, because again, they do have all kinds of information on the cloth mask recommendation. And I will tell you in all honesty, I see team, our Dubuque County Public Health Incident Management team, looked at both spectrums of getting this information out to the public. We were looking at campaigns of how to make the masks, because it can be simple, and they do have YouTubes online as well with the CDC. It can be as simple as using a kitchen towel and 2 rubber bands to make a mask. Again, we're stressing to people that the mask is really to protect those people to protect yourself. Well, not yourself, but to protect other people, because if you have the virus, we don't want those air droplets to be going to someone else. But we did look at, everything. We looked at, should we get a call out for people to make masks? Should we do a distribution throughout the county at convenience stores or senior citizens centers, or whatever the case may be? But then we had thought, we really want our information to be stressing to stay at home as much as possible. We do not want people to go to any of these sites to pick up masks for their family members, when masks can be made as simple as can be in their home using material that they would have at home. So we're on the other end of the spectrum. We're just trying to encourage people, don't go out of your house, especially right now. Stay at home as much as possible. If you do have to go out and do grocery store shopping or picking up drugs or at your pharmacy or whatever the case may be, we're again encouraging limiting those trips to the grocery stores, limiting those trips out to the pharmacy. And if you do have to go out, only go out with one individual. Don't take 6 family members along. We're also encouraging, if you do have to go to the grocery store, to utilize the curbside pickup, the carryout, the delivery. But if you do have to get out of your car, again, practice social distancing. We really want people to be following self-isolation practices. So we had even talked about the billboard campaign, and we thought that would be good, but then we thought we truly do not want people in cars driving out to even see what billboards might be saying. So we're thinking more in terms of, again, telling people, stay at home, stay safe at home. Stay in your house as much as you can. Only go out for those essentials. You're not bored at home. You're safe at home. We all have a role to play in limiting the spread of the virus. We want people to stay home as much as they can, but if they have to go out, wear a mask to protect yourself and others. And we can't stress more to stay at home if you're ill, because we know most people who have the virus could experience mild symptoms. And even if they do have the mild symptoms, they need to stay at home until it's been 7 days from the onset of the symptoms, that all of the symptoms are improving, and until they're fever-free without any medication for at least 3 days. And we're still telling people, if you're ill, don't get into the car and go to urgent care or the emergency room. We're telling people, please call first. We want people to stay in their home, call the healthcare provider before going to the hospital or the clinic, because those places do have processes in place, and they can do a lot over telemedicine techniques right now. So again, we're just encouraging people. We know not all people have the internet or the YouTube availability to look on the sites to even make a simple mask. But again, our message is loud and clear. Stay at home if you can. But if you do have to go out, we are recommending wearing a cloth-based mask. And we have had questions about, well, what about the cloth covering? What should it do? Well, on the CDC, it tells you exactly. It should fit snugly but comfortably over the side of the face. It should be secured with ties or ear loops. It should include multiple layers of fabric. You still need to allow for breathing without restriction. You should be able to launder and machine dry without damage or changing the shape. Again, just common sense, that they should be routinely washed, depending on the frequency of the use. And again, they're not really encouraging wearing the cloth face covering should not be placed on young children under the age of 2 or anyone who has trouble breathing or if they're unconscious or anything that they're not able to remove the mask without assistance. So with that, I guess with all of that, with the cloth mask recommendations, we would first like to take the stance that stay at home. The second stance would be if you have to go out, limit your outings, limit the people who are going with you, and utilize those services that are available, such as the curbside pickup, the delivery, any mode that you can do right now, especially for these next 2 or 3 weeks. It's so important. Just stay at home. Social distancing cannot be stressed enough. And even if you are out and about wearing a mask, always keep your hands off of your face when you go to remove the mask. Good hand washing, at least 20 seconds. So with that, that's pretty much what I have with the cloth mask recommendations. Any questions on that?
Patrice, this is Diane Pape-Freiberger. The second bullet under the cloth masks is distribution. And I know that Tom Berger at one time was receiving cloth masks out at the fire station out on Sipel Road there. Is he continuing to receive those? I've seen all over on social media where people are taking them into a bin at Hy-Vee, which I would be very cautious about doing. Very concerned about that, even though they're in Ziploc bags. It's an increase in traffic in that area. But so as far as distribution, I think that people need to look at where their sources are in the city of Dubuque, but they don't know what their sources are. So they're struggling.
Sure. And when we do get, and that's a good point, Diane, when we do get the phone calls or the emails, we tell people, because many of our people who are making the masks already have a place for their distribution. So we are encouraging them, if they have a place, whether it be a hospital, long-term care facility, healthcare provider, their church, or whatever their case may be, to do the arrangement with the place that they are already helping out. But we are telling people if they don't have a place, if they just want to help by making the masks, then yes, contact Tom Berger, or else we then if they contact one of us individually, we do tell them that Tom is still accepting masks. Right now he does not have a large supply, but he does have some on hand. So if an agency were to be short and if they needed some, we would encourage people to call Tom Berger. And then we're also
Patrice?
encouraging,
This is Tom. I'm kind of between the Homeland Security and that. Ever since they come out with as far as the distribution, ever since they come out with the recommendation for everybody to wear masks, we haven't had any calls. Had them, so I think they're distributing them on their own. But we definitely don't want, we'll have to figure out some other kind of distribution because we don't want people coming out here, especially because if we end up losing this place, we need to keep this concern for medical equipment. So something else will have to be done for distribution of the personal masks. And like I said, since it came out in the last week, nobody's called, and we have less than 20 of them here, and that's kind of been given out.
Thanks. And we do encourage people too, even in their neighborhood, if they can drop some off on a porch of their next door neighbor, keeping that social distance, or relatives, or whatever the case may be. So we're really not, just like Tom said, we're again not encouraging the distribution of the masks right now. We're just more or less encouraging people to stay at home and limit your outings. But if you do have to go out, then do wear a cloth mask.
And Patrice, this is Diane. I agree with that. But Tom just mentioned we do need to figure out a way of distribution to the public if they want them. Who is we need to figure out a way, and is there a time frame on that?
I guess I didn't mean we. I mean, that's something you guys can figure out, and if you put a nonprofit in it. Some people are, I think, like a couple of the businesses in town are taking them to and distributing them So, but that shouldn't be, I mean, I just don't want to commingle public with what I'm trying to do to keep supplies, PPE, and hospitals and long-term facilities.
This is Diane Hyken. And I guess I just need to explain. So recently I started kind of my retirement job. So I'm working as a cashier at the Walgreens on East 20th. And I can tell you in that neighborhood, Patrice, I appreciate all your comments about people staying home and, trying to use curbside delivery and things like that and not going in cars. There's a large number of people in our community that go places on foot. And so they get limited numbers of groceries at a time. They are making trips to their corner drugstore. The biggest question I get is, where can we get masks? Yesterday, there were quite a few questions from some men that are workers at a local plant that were a little bit in a panic because they needed to have masks to go into their job shifts, apparently yesterday. Their employer is going to be supplying masks, but in the meantime, they have to supply their own. I guess I'd like to maybe see if we can shift the way we're doing things and the way we're planning things and kind of follow our own advice. We are asking people to operate, I've heard this many times, on the premise that they are infected. So I would like us to operate on the premise that we don't have 30 people in our community that are positive. We have, using Dr. Canero's estimations, I believe you multiply that by 50. We have 1,500 people that might be unknowingly infected. I believe Dr. Canero's post was on March 22nd. I wish he was on the call. I don't see that he is to confirm that, but we're lulled into a false sense of security is what I'm hearing from people in the community. My retirement job from pharmacy was intended just to be something part-time, but I've been working quite a bit at the Walgreens on East 20th, and I'm hearing our community talking. I'm seeing the anxiety. I'm seeing the conversations that are focusing on misinformation getting out there. So I would like us to start operating on the premise that we have a much higher positive caseload than our tests are showing, and I think we can address that in the next item when we're talking about increasing our testing. I'd like us to operate on the premise that we have a positive case of either a staff member or a resident in a long-term care facility. We need to be planning for the worst. We need to operate on the premise that we're going to have a surge because we do have people coming from the Chicago, Milwaukee area. I'm seeing that at that store as well. People are fleeing from areas that they're concerned about where they consider themselves to be in a hot spot and they're living in close quarters. So I would like to have a little discussion. Do we think it's possible to distribute cloth masks through our food programs, just as a start? So when families are going to pick up meals for their kids through already existing programs, and they're picking up meals, I think, for their other family members as well, can we look at that as a start of distributing cloth masks somewhere where people are already going, whether it be one person in a car or one person on foot?
I think that's a great idea.
Well, and we did talk about the schools that are still distributing meals and the senior citizens, and I think I already mentioned that at the very beginning. So we can go back and look at that, Diane.
Okay, maybe I'll make a motion that we plan a distribution system for cloth masks for our community at the food sites that are in operation through the school district and at the senior citizen meal site programs.
I second that motion, Diane.
Okay, we have a motion and a second. I guess I would, in form of discussion, I would ask, please define we and how would this work? Unless that is an action item we take from this motion and figure that out.
We, I think, is...
Sorry.
Oh, go ahead. Go ahead, Susie.
Okay, this is Susie. I'm wondering if we can't talk to somebody in the school district. I talked to Taj Suleiman, who's their equity director. I email with him quite a bit these days. And there are Facebook groups making masks. I'm wondering if we can make that connection. And we, as the Board of Health, I think we should be in a leadership role of this, trying to take care of our community And I think Diane's idea of distributing masks at the food places, even food pantries like down on Jackson, I live downtown. I live down on 14th Street. Nobody is wearing masks that walk by my house. Nobody's wearing them. So I haven't seen one person, and I've got pretty good foot traffic going by my house. So I think connecting with the schools would be a good first step. I would be happy to talk to Taj and see if this is something we could do. Anyways, I'm laying that out there. I think this is a good idea. I think we need to get the mask out there or get ideas or flyers on how to make them out of bandanas and rubber bands or whatever. But I think something needs to happen, and I think we should be at the forefront of this since we are the Board of Health.
Thank you, Susie. Anyone else?
I was going to say, if Susie is volunteering to be the chair of this, I'll be glad to provide her the information for, I'll be glad to help her in any way that I can. But I don't know if she wants a subcommittee with Diane and Diane. I'm just looking at the group that would be working with her, but I just want her to know that if she is taking this charge, I will help in any way that I can do.
Okay. This is Tom. I would like to further suggest that if we're looking at school lunches, we look at food pantries, as was suggested, and bear in mind that we have food pantries in Farley, Dyersville,
Worthington,
Epworth, so we can service the entire county.
Absolutely, Tom. Thank you for mentioning that. And I believe there's a food distribution program through the West Dubuque schools as well.
Right.
So any of them, not just in Dubuque, the city, no, absolutely the county.
Okay. Any other discussion?
I would add, I would be happy to be, this is Diane Heiken, to be on the committee with Susie, and maybe can tackle the source side of it as well, if she wants to look at the distribution.
Okay. Okay, Susie, are you willing to take that on?
I am willing to take that on, and making connections throughout Dubuque County to see what we can do to distribute masks.
Okay. So we have a motion and a second to establish a process for mass distribution through the schools and lunch distribution programs. Susie Stroud will take charge of that, and Diane Heiken will help on the instruction side. All those in favor?
Aye.
Okay. Aye. Opposed? Okay.
I'm guessing you've got people who are muted.
Yes.
Anybody on the Board of Health or Board of Supervisors can unmute themselves.
Okay. From the looks of it, Susie, you're muted at the moment.
Aye, I'm agreeing. I had to walk away. Sorry.
Okay.
For a second, I'm agreeing with it.
Tim Daly, you are muted. And Todd, you're not muted. I assume yours was an aye?
Aye, yes.
Okay. Okay, motion has carried 6-0. Okay, the next item on the Board of Health agenda is local testing. I've got two bullets on there, local readiness and local testing availability. So I would open that for discussion.
Tom, I sent a letter to you and Patrice the other day, and as a Board of Health member, I want to see more public testing available. We need to get that up and running within a week, and we as the Board of Health need to put the money in place to get it done, is what I propose. As Diane Heiken has just mentioned, we had received information, from Bobby Canaro, who is our medical liaison, that we are not testing enough. and that we can assume that there's more cases within our community. When we do not know what the numbers are, to begin with, if people look at a low number, they have a false sense of security, number one. The other thing is if you go into any institution, they don't want to let you in unless they ask several questions. And one of them is, have you ever been tested positive for COVID-19? The other thing is, have you ever been in contact with somebody who's been tested positive for COVID-19? If you say no to both of those, they will allow you in. But if we have not had the test, or if the people we are associated with have not had the test, it could be positive. We just don't know. So I propose, as the Board of Health, that we get more testing available. If we need to purchase it from someone other than from the state, that we use Board of Health monies that were appropriated by the Board of Supervisors, and we need to get that up and running within the next week.
Would you like to hear my report first before you make any motion on this?
Sure.
Because that might change your motion. I mean, I don't want to interrupt. If you want to continue, go ahead.
Patrice, I would like to hear from you.
Okay. I did check with both of the hospitals, and Mercy won. And basically the questions that I asked Mercy and Finley were, how many tests do you have? Do you feel you have enough? Do you have the availability to order more if needed? And right away, the clarification, which I appreciated, is that they do not have tests in Dubuque. They're called collection kits. The tests are then sent to the hygienic lab, Mayo, or a private laboratory, which, you know, I appreciated having that clarification because we all refer to it as tests, but the proper terminology is collection kits. So with Mercy, I'm just going to read their responses to you. They had said that we have over 1,000 collection kits. We currently send the test to our state lab, Mayo, and we are getting about a 48-hour turnaround time. We have not received any reagent as of yet to perform the test locally, in-house with the hospitals. And then I asked, do you feel that you have enough? And they said, so far we have been able to keep up the demand for the collection kits. And then, do you have the ability to order more if needed? And they said, our orders are trickling in slowly. They have split the collection kits to double our capacity, and they're preparing substitute options such as buffered saline and sterile tubes to keep up. Unity Point, with those same 3 questions, they had, for the number 1, how many tests do you have? They said this is a moving number. It's the media that is being used for not only the COVID testing, but for the respiratory panels and for any upper respiratory infections. So they have split some of that media to make that last longer for the COVID testing kits. And they said, yes, we feel as though Finley has enough. And yes, the orders are still being allocated, but they're still receiving supplies. So with that, I will just say we can go ahead and talk about ordering kits, but it looks as though the allocations are still there. And then I just wanted to share with the testing and the screening, we did look at all of the other option sites, the providers. So like, for instance, medical associates, they're doing their screening questions outside before the patients enter the building. They're using colored wristband systems to identify patients based on symptoms and then to get to the proper location once they're inside of the building. Mercy One, the patients are not requiring, that do not require a full, complete emergency room care, and have a fever or an upper respiratory symptoms, they are seen right outside. They have the 3 pods. If you've driven past any of these sites, then you'll know a little bit more of what the report is on. And those pods are used for the fast track testing and evaluation. And Finley is basically the same as Mercy. The Grand River, they're doing their testing and their upper respiratory infection clinic in separate spots in their location. And all of these facilities have been doing these screenings for not quite 2 weeks, within the last 2 weeks. And Crescent, they too have an outdoor screening now of patients and triaging. They are at minimal for their collection kits. But everyone else that we had checked are pretty much adequate, but everyone is still saying that they are being allocated those collection kits. So I don't know if even as a Board of Health that you would, and I don't know, I'm just saying this, I don't know if you would have the capability of ordering testing kits above what is being allocated to the healthcare providers right now. And also with our testing site, our committee that we have looking at our upper respiratory testing site, they're still in their final stage. I did ask for an up-to-date report to share with you right now, but all they could say is that they're in their final stage for getting that up and running. So, and with that, we will be working with supplies that they would need for those parking lot or whatever one of the three sites that they were looking at for their drive-through screenings. So with that, then Diane, I'll turn it back over to you, or Tom, or whomever.
Okay.
This is Diane Heiken, the other Diane. So Patrice, I'm a little confused because the Fury Clinic has been in their final stages now for a couple weeks, is what we're hearing. Is that not correct?
Yes.
Okay.
For last week.
Okay. I guess it would help if we knew what the barriers were. And, you know, I've been on the planning team for the Iowa Governor's Conference on Public Health for the last 2 years. In fact, we were supposed to be at it right now, you and I, as well as other people. And one of the people that I was on the planning team with is your counterpart, Kevin, in Woodbury County. And they have a model up for drive-through testing that they were doing. And Kevin stressed, he sent me that model, their algorithm, the order the providers came up with, the procedure sheet that they give to patients. They've been running it. It will be 2 weeks on this Friday, I think it's been running. And I guess I just like to know if we could get a firm report of what the barriers are for our group, because Kevin stressed public health starts the conversation, but it is the provider's role to do what works for them. They're the ones issuing the order. You know, it's an order that someone goes be tested. They are the ones that need to be comfortable with it. And I appreciate the effort that they started this and have been looking into it for a while now and collaborating. But it would really help if we knew where it was going and a date. You know, will it be going next Monday? You know, what kind of concrete information can they share that can kind of let us know what direction our increased testing capacity is heading? We really need that because I do think our numbers, they're not helpful because we don't have an adequate number of tests. So does anyone, I think when Kay Takis did the press conference last week, even on March 30th, they talked about looking at other models from other Mercy Ones, and I know they've been looking at other places. So do you know what some of the barriers are?
I do not know what the barriers are, but I can tell you, let's see, their goal. I mean, I can just share a few things that I have in front of me. The goal and the purpose, of course, is to establish a community testing offsite location that can be operational when the volumes of patients requiring testing exceeds the current capability at local provider facilities. The benefit of a community testing location is to offload testing volumes and exposure to clinics for those who just need testing but might not be seen by a provider. The patients would be triaged by a nurse to determine the urgency of needing to see a provider or emergent care. As the COVID-19 pandemic changes daily, a test site and the volume of the sick people in the community may require the scope of a community site to expand beyond just testing and also to include the fever upper respiratory infection client site located at that site. And then the researching has been done. The team members have reached out to several organizations to gather information about the structure from similar community testing and fever upper respiratory infection sites in other locations throughout the state of Iowa. They have their different phases in place, and they're pretty much, site of selection. They're basing it on 3 locations right now, and all those 3 locations were based on the ease of access for the public, drive-through capability, traffic safety, and efficient traffic flow, on-set restrooms, hand washing stations, adequate space for larger numbers of vehicles, internet access. The patient flow would be phone screening or COVID phone screening with a form. Phone registration. Oh, this is if they had to refer these people to a healthcare site itself. And then they're still in their final stage. So that's all I can share with you right now, Diane. I can get a hold of the chair of that committee again and just say that you're asking specific questions and we need to have specific answers, and see if we can get any of those specific questions answered for you.
Okay, thank you.
Hi, Mike. This is Ann McDonough. I hear you are beyond the get back to me stage. We are in the execution stage of this Board of Health. To me, seems to want to move forward with aggressive testing sites. So it's not about, when we Zoom next, maybe we need to have some of those providers be present. Because this is the same discussion going around. It's just not supervisors having the discussion. It's the Board of Health now having the discussion. And we have to have more tests here. That's being demanded by the Board of Health. And the supervisors are supporting that with, the financial money that has been appropriated for the Board of Health needs. So I don't understand the barriers, and it's not okay that we just don't know anymore. On Monday, we need to have specific, concrete answers to begin the next part, which is the execution and the action plan. I think that should be doable. And, Diane, go back. What are your remaining questions?
Well, I guess I wanted to clarify. So a couple things, both in, and I'm going to reference Kay Takis again in the conference last week. I believe the way she worded it was that it would be for essential healthcare workers and eventually for community members, the Fury Clinic. And we just can't do eventually anymore, okay? We don't have time for that now. That was on March 30th, and we don't have time for that. We have to have it in place before things get bad. And I also don't think it should necessarily just be for when testing capacity is reached. I would like to be, as Supervisor McDonough said, aggressive with the testing, because we know that people have it and they don't know it. And people are frustrated. People are saying they're not able to access it. I had a family member, he and I were both in New York at the beginning of March, and he's in the Army. So, that kind of was part of the referral. He had to have a test, and it wasn't easy. Luckily, he was negative, but it's not an easy thing to access. People still don't understand, even from all of the education and the guidance that we're giving. People still say, how do I get a test? So Patrice, what is the first step right now? Do they contact their primary care provider? And if it's a weekend, what do they do?
We encourage everyone to call in. Do not go in. Call in with a telemedicine that they can do through FaceTime, the phone, whatever the case may be. That healthcare provider then can do a screening assessment, and they can actually do a treatment over whether it requires, if they believe, medication or whatever the case may be. But if they do need to be seen, then that health care provider would direct them to come to whatever clinic that they are designating and work with that person or their client or their patient or whatever to come in for the adequate care that would be needed.
Patrice, what do they do if they don't have a primary health care provider? Who is that? People have lost their jobs. They know they've lost their insurance. How do you begin this? Assuming you don't have an established relationship, now what do you do?
Crescent is still open and running for the essential services such as this. And if they do have any questions, we still have our call-in numbers that are manned by, or that are open down at the Visiting Nurse Association. They can call and get guidance from our communicable disease nurses. And the Iowa Department of Public Health is still opening their 211 if they would have any specific questions for the Iowa Department of Public Health. And please know, we are working on this. We are doing everything that we can do. So don't think that we are sitting back, putting this on the back burner. We are not. This is as important to us as it is to you.
Patrice, I understand that. This is Diane again. It's just, we are at a point where, I mean, we're volunteering to help. We're saying, what are the barriers? What do you need? I think last week on the Board of Health call, you said that, volunteers would be welcome or more input. And I volunteered and I've heard nothing. So I would like to be connected, if possible, to the people working on that. Do you remember that?
Diane, I just know that there's certain committees that are already up and running and that they do welcome people, but there's some committees that if you bring in a new person for any type of a situation, if they're nearing their conclusion, then that person might not be needed at that time. So you can connect. I can talk to you later on this, Diane. I can connect you with that group if you want me to. I'll just say that.
Okay. I mean, and it's not about me. It's just, I think so many people.
No, I fully understand.
Yeah.
And I just want you guys to know that we too believe that this is a very important project. And we all agree. We're all on the same page. Yeah. So it's
Maybe
not
I can jump
that.
In. Well, this is Supervisor Wickham. I think the big question I hear is, what's the role of the Board of Health? So is the Board of Health just going to be very passive and receptive to information from people like yourself, Patrice, and others, or are they going to be an active body? They're going to be an active, proactive component to help, keep the public safe. So that's probably the big question in hand of what the Board of Health wants to be. And I'm hearing from some members they want to be more active. But Chair Besham, that would be directed to you, is what role does the board want to have, and the members should speak and therefore direct that action.
And we would welcome that, just know that. So I'm just glad that Susie took charge of the distribution. We will welcome additional help. So Diane, if you're willing to work on the assessment with the barriers and everything in place, I will hook you up with that group.
Thank you. And I appreciate that you are stuck in the middle in a lot of these situations, Patrice. And I really do appreciate that. And it's difficult. You're in a difficult position. So it would help, to have some direct contact with some of the people that are planning it. And, barriers are in all situations, and we just want to remove them and get it going.
Patrice.
And like I said, we'll appreciate your help. What, Tom?
This is Tom. Would it be excuse me. Would it be
You have to love technology, huh?
Would it be appropriate to invite the chair of this committee to attend the next meeting? I'm sensing a lot of frustration here, and I want to make sure that committee feels that frustration.
Absolutely.
Because we're spending a lot of time talking, and we don't move any farther.
Absolutely. I will contact that chair and ask if they would be present. And it might not be the chair. It might be a committee member. If the chair is not available, sure. Nope, I'll be glad to do that.
This is...
Patrice, this is Diane Freiberger. With the data that Mercy has around 1,000 tests, we're assuming Unity Point maybe has that many, maybe has less. We don't know. So 2,000 test kits for the whole county is what I'm looking at. I'm not seeing that as enough, and we also don't have a method set up for people to come in and get their test kits. I'm hearing from, to get the tests, and those are collection kits, term now. So that's why I'm proposing that we have something set up. This is not a time for us to do planning now. This is time for action. We've been planning for weeks and weeks and weeks now. But now, with the data increasing, and we know that there will be a surge coming, we need to act. And I know that we also have now, I see him on the screen, Ed Rager, who may be able to help you with when you start communicating all these things to the public. So I know that there still might be more discussion on this, but there is a motion on the table at this point.
What is that motion, Diane?
The motion is that we need to ramp up and get the public testing available, and that we use the money, some of the money allocated by the Board of Health, to get those test collection kits if we need to, if we are not able to get them through the state, and we need to get this up and running within the next week.
And Diane, I'm sorry, is there discussion yet?
Well,
Chair Beshen, if I may, I'm going to request the ability to comment, if you
yes.
recognize me.
Yes, Dave Baker.
Okay, thank you. First observation is I was a little disappointed in the report from Finley when asked about the number of tests, because I didn't hear an answer. I don't know if anybody else caught that. Mercy said they have 1,000. Finley didn't really give an answer. So I'd like to have somebody follow up with them, and let's have answers. We don't need secrecy. We need transparency. The other thing is that's related to this motion, I believe, is at the last couple meetings, we have talked about being contacted by employees, for example, in factories where there have been positive tests, people told, they must report to work, and they're afraid to go to work, and they don't know if they were exposed or not. And I believe they have the right to know. And and Patrice, you can correct me if I'm wrong, but there are some of these symptoms, some of the people that are carrying the virus are asymptomatic, so they don't know that they have it, but a test would provide that information. So I guess as part of this, I'm not voting on this, but I just wanted to put that out there as another reason we may want to expand testing. Workers are nervous, and of course we have our healthcare professionals and support staff that are going to work every day facing this virus, but we also have employees in essential positions that have a lot of question marks, and it's causing strain, brain health issues, and fear. So I think testing would help relieve some of that. Thank you.
And Dave, I can respond to you. We are all concerned about people. We're telling people, if just treat your next door neighbor or your relative and treat yourself as though you do have your asymptomatic with the COVID. But we also know that we do have restrictions. If we are seeing that places are still being allocated for the testing collection or the collection kits, I have to even get that terminology into my language now, that's beyond our control. We need to be working with a governor or higher ups to get that changed or get more collection kits available even in the state of Iowa, that it can be distributed to places that can increase their testing. So that's why we're somewhat in an awkward spot, that if we're limited with our collection kits, we still have to then be promoting the preventive steps that people can do with the social distancing, staying at home, and everything else. I know we sound like a broken record when we're preaching that, but right now there's some restrictions that are preventing us from expanding the testing. If they're only being allocated X amount of tests per day or per week, that's a state issue. It's not a Dubuque County issue in my eyes, and something has to be changed outside of our county. And also with people who are concerned, if they're working beside someone who might have been tested positive, please know that our communicable disease nurses are doing their job. They are doing the assessment. They're doing that screening tool that I had provided at our last meeting. They are reaching out to those people that have met that criteria, that they need to be reaching out to someone who might have been close to them that have tested positive with COVID-19. So some of those things are being done. Well, they are being done. And what we need to do is just reassure people again. We don't want people to have increased anxiety or tension. We want those answers, those questions answered. So we encourage them to call the Visiting Nurse Association, call that call-in number. We don't want them walking around for 3 days worrying that they might have been in a grocery store next to someone. You know, we want to help people with any of those situations at all. So thanks, Dave.
Yeah, I'll just comment. I don't want to debate with you, Patrice, but
no, I'm not debating.
If there are barriers, please identify those. If there are rules from the state, please identify those, because then we'll know if the state is not providing all the information. But I think the motion is, if the state won't provide them, let's see if we can find another avenue to acquire tests and do it ourselves. And I don't want to speak for whoever made the motion. They can correct me if I'm wrong.
And I'm not debating, Dave. So I hope you know that.
Tom, I would like to second the motion that Diane Pape-Freiberger made. This is Diane Heiken, so that we can have discussion. And thank you, both Patrice and Supervisor Baker. I appreciate your conversation there.
Okay, so we have a motion and a second, and I just want to clarify that we're talking test kits, because to my knowledge, we don't have the ability in Dubuque County to perform a test. Is that correct?
Are you asking me, or who made the motion?
I'm
yes,
asking.
Correct. The hospitals do not have the capability. Yeah, the hospitals do not have the capability to run their own tests. They're still utilizing the hygienic lab, Mayo, or a private lab. Correct.
Okay, so the motion is to ramp up a test site, a test collection site, and provide test kits.
Collection kits.
Collection kits. Okay. Any other discussion? All in favor?
Aye.
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 Aye. Todd?
Aye.
So that's 5. Anyone else on the board? Susie, you're muted. Susie Stroud, you're muted. Did you vote aye or nay? Motion carried 5-1 or 5-0. Okay, the last item for the Board of Health is some guidance on the $500,000 allocation. two questions are, one was, where do we see this money being spent? And we can just add test kits to it based on that motion. The second part is, what kind of oversight does the Board of Supervisors require from the Board of Health before this money is actually spent? So, Patrice, I think you've indicated that we expect to see claims first from the Visiting Nurses Association for the expanded services they're provided.
Right. And do you want me to start talking on this, Tom?
Yeah, please.
Okay, I can give an overview of this. We did come up with a protocol with the Board of Supervisors directive when it was approved for the $500,000 that the money would go into a line item for the public health issues for the health department budget. And we were looking at the public health incident management team that would evaluate the spending and the funding of the request. We basically broke it into three criteria. The first one being for public health staff, and that being for any staff overtime. We were thinking primarily at that time when we were putting this criteria together for the Visiting Nurse Association, because we do have the communicable disease nurses that are now working on the weekends. They've extended their hours. We do have the nurses working with a call-in, and we have increased that call-in to 7 days a week. So with that, we were looking basically at that time, but it would include other public health staff as well, if the need came to be. Then for the healthcare component, we were looking at the personal protective equipment, and we were also looking at with the test sites, we were looking at would there be a rental cost for that space? Would we need security? Would we need the equipment supplies? Would we need any signage? Would we need marketing, advertisement? Would we need any transportation needs to get people there if they did not have those needs? Educational materials, would we be doing billboards, pamphlets, whatever the case may be, to be getting this information out? And then would also be looking at who would staff the testing sites. Would we need to have temporary staff? Would we have to have consultants? Would we have to have additional staff as well? And then we were looking at just generally for our community partners, looking at our personal protective equipment, again, supplies, any educational materials that they could be distributing for the staff and the public as well. And we have been trying to utilize other funding before we touch the $500,000, but Stacy did or is submitting a bill for the month of March, and that includes the salaries and supplies that were needed for the communicable disease nurses as well as the call-in components, and that billing was $22,676. I have worked with Tom Brugger with personal protective equipment, and he has not had to tap into these dollars as well. We're also looking at the CBG grants with our testing. We're looking at the possibility for the community block development grant. We're looking at even with the testing sites, when we collect the addresses, would we be able to see who are county residents and who are city residents? Because our county dollars can only be spent for the county, city only for city. We're looking at would that be another means of helping with any of this funding? So right now, those are the three main criteria that we're looking at for the $500,000.
Okay, so what I'm hearing is that any test kits we'd provide for a temporary drive-up test site would be included.
Correct.
Okay. Are there any other questions of Patrice?
Patrice, this is Diane Pape-Freiberger. I have one question not related to the test kits or the collection kits. Are we on to any additional items here?
I'm open to anything, Diane.
Okay. I have a question. If someone tests positive, and we want them to isolate separately within their homes from the rest of their families, but not all homes are set up that way, do we have a facility where it's set up in Dubuque where they can self-isolate away from their families so their families aren't exposed?
I do not know the answer to that. I can look at that. I know that the housing department with the city of Dubuque has actually looked at different facilities. Like even we were talking about, or we were looking at even with the homeless population, if we were to see them, or if we were to have someone who was basically homeless, they did test positive, where would we have them self-isolate at? So I know that there have been some locations that, but again, that's for the city, but the county residents, if the address would be for the county, it would be a facility that we could look at. But as far as with the isolating from home, I believe that the communicable disease nurses are still stressing, even if you have to be in a bedroom by yourself, and if you have to use the restroom, that once you clear the path, let the people use the restroom, but once that person leaves, thorough cleaning has to be done in that bathroom. But isolate in one room of the house, and even with meals, they have been instructed to bring the food right to the bedroom door or whatever room that they're isolating at in their home, and then leave that area so the person who is inside can then go ahead and take the food from the other side of that door. And then I know that they have been instructed on the cleaning components within that house. But if they do have someone, who is self-isolating at home, the communicable disease nurses are probably looking at the contact tracing, which would more than likely involve other members of that house as well. But yeah, if they do have to isolate in one room, the communicable disease nurses are working with those families.
Thank you. Ed Raber just posted a comment that the housing in the city of Dubuque is looking at or has set up an isolation center facility or facility for isolation. We also probably need to look at that in the county also. So, but thank you.
Sure.
Okay. All right. Thanks, Diane, for your question. So then I would address this question to the supervisors. So are you okay with the approach that Patrice and the incident management team are taking toward the use of this $500,000?
And can I also share that Stella and Dawn have also been involved in this process? And Stella being our finance director and Dawn being our human resource.
Tom,
okay.
Okay, go ahead, Jay.
You've got some of the pieces in place, so certainly want to keep the budget director advised. I would not stray necessarily too far from your Board of Health, and so the Board of Health should be basically looking at those proposals. They should be asking and requesting proposals from a variety of sources, reviewing them, vetting them, making decisions, voting on those expenditures, and then processing them. That's why we have a Board of Health. So I would push back to the Board of Health to be that governing body for those expenditures. Obviously, giving discretion and hopefully empowering the incident management team as well. But that's the key role I would see of the Board of Health.
Okay.
And Jay, I can share that when you did give this proposal of the $500,000, if I remember correctly, there was discussion regarding would the Board of Health have to approve the expenditures, and I believe the comment was that you did not want to have the expenditures be held up to get final approval from the Board of Health, and that's how we were operating.
It still stands today. I don't want to hold up anything.
I just wanted, correct. I just wanted clarification.
Absolutely. No, voices from the Board of Health be proactive, and I'm very pleased. So be proactive.
And we will communicate.
Serve the needs of the clients, and make sure that you can do all you can to make sure that we're keeping people safe, we're providing them masks, we're doing everything we can for testing. The role of the supervisors is to appropriate. We've appropriated funds. We need now action. We need help with the action. Let the supervisors know. And that's a comment not to you, Patrice, but to all of the Board of Health. I don't think you need another task, Patrice. The Board of Health needs to lean in and start to lead this process. And then if they need help, let us know.
Yeah. And I just wanted that for clarification, so thanks, Jay.
I also need clarification, and maybe Stella Rundy can be unmuted for this as well. With the hiring of the interim director for the board, I understood that salary is coming from this account. That's what I understood last week when this hire was made. Stella, what is your understanding of where that's going to come from?
My understanding was that would come out of a different county account that we had appropriated other funding into, not out of the Board of Health account.
Okay.
Dave Baker here. I guess if Stella is on, and I don't know if Denise is on or not, perhaps Megan Bonnert. We have layers of our approval process before checks are cut, and these safeguards will remain in place for expenditures from this allocation. Is that not correct? We have our claims.
That's
process.
correct. Yep, the claims process has not changed, so everything would go through as normal.
Okay.
Okay. All right. Thank you very much for your comments.
Well, and could I just also add one comment that I just want you to know that the Board of Health are helping. You know, they are being proactive. They're wonderful collaborative partners. So I just want everyone to know that they're not sitting back, you know, just looking at everything. They are active workers, and please know that we do appreciate that they're members of the Board of Health.
Thank you, Patrice. I have nothing further for the agenda, so guess I would entertain a motion to close the Board of Health meeting.
I second the motion.
Okay, that was Diane Pape-Freiberger.
Yes.
Okay. I would entertain, so Diane, I assume you're making the motion.
I'm making the motion.
Can I have a second?
I second. This is Diane Hiken.
Okay. All in favor?
Aye.
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 Okay. All right. I'll turn it back over to Dave Baker.
Okay, thank you, Chairman Beshen. All right, we'll move on the agenda to item number 3, which is County Operations Response Plan. And this is a carryover from Monday's meeting. So item A, shelter-in-place orders. We have under the first part of this, the county attorney's opinion, which came after the last meeting. So I don't know if is that going to go up on the board, Dawn? I think CJ's letter. That's the first thing. It says county attorney opinion. Okay, so the county attorney has issued his legal opinion regarding the ability of a municipality or county to issue a stay-in-place, shelter-in-place, stay-at-home, safe-at-home, whatever the order or ordinance would be. And he's indicating that the governor is the only one that has the ability, the authority to do that. And I guess I'll start on this. I am not wanting to have a legal debate or skirmish with our county attorney. I greatly respect him and his opinion. And at this point, I don't want to belabor this specific proposal that we had. It was a draft. I think it was good to, again, get the discussion out there and remind people that they should be staying home unless it's absolutely essential, that they go out. I had lots of questions sent to me. I had reviewed other states. There were questions about under the document that had been presented whether somebody could go help their elderly parent at their home under that order. I couldn't answer it by looking at it, but I did review Wisconsin, Illinois, and that would be okay under those. But the bottom line is, it certainly appears we don't have the ability to take this action. So my position is that we should respect that and move on and keep encouraging people to stay at home and be safe. I'll turn it over to Supervisors McDonough and Wickham for comments. You're both unmuted. Maybe you don't have anything to say, so.
I have a comment. I was just going to give Supervisor McDonough a chance to jump in, but if she'd like me to go first, I can.
Okay, please do so.
So I agree with you, Supervisor Baker, as far as I have respect for CJ May and his experience, albeit relatively new in this position, just like many of us three. My faith is more in the medical community at this point and less in the legal community. And so I'm not one to just take a statement from a very respected lawyer related to what our abilities are. I believe as a board, we should act in the best interest of the community, and we should follow the direction of the medical community, which has clearly stated that we should stay at home, and we have the power through resolution and ordinance to do that. My main justification would be probably twofold, is that we're unique. So we're in a unique position. We have two states that border Dubuque County, as we all know, Illinois and Wisconsin. And so right now, you have nothing legally that would prevent somebody from Illinois and Wisconsin of free roaming in Dubuque County. So there's nothing legally to prevent that. And during a pandemic, I think that's problematic. So that would be the first thing that makes us different than many other counties throughout the state of Iowa. So that's one reason I would compel us to act. The second is, you brought up earlier, Supervisor Baker, a scenario. So related to workers that, are doing, whether it's light manufacturing or other types of positions, without the legal cover of a stay-at-home ordinance or a resolution, they have to go to work and they have to basically comply with what their employer wants. They can't go on unemployment. They don't have that option. And that's a tough position to put people in that might have people at home that are at risk, or they have family members that are at risk. And so this would also allow us to give them a little bit of options. So I would encourage the board to consider moving forward with the resolution and the ordinance and those discussions and those actions.
Okay, thank you, Supervisor Wickham.
So when we last met on Monday, I indicated that I was in agreement with the sentiment behind this and people's desire, some people's interest in having firm communication about the need for people to stay at home. I think that's been communicated. But I think we also have to recognize that certainly I have respect for the governor and I have respect for the Attorney General of the state of Iowa, who have issued directives and have been diligent in the decisions that they have been making. Whether I wish that their communication was stronger is a personal opinion. It isn't a fact. And I would have, as I indicated on Monday, we don't have the authority to do this. I'm, of course, pleased that Attorney CJ May, our county attorney, has set that forth. I would draw citizens' attention to one other piece of this opinion, which says in the third paragraph, the last concluding sentence, and this I think is primary also to our purpose in serving our citizens as supervisors, and that a county attorney indicates to us that enacting a stay-in-place order by you would, in my opinion, be subject to time-consuming and expensive legal challenge, and may very well expose the county to liability for damages incurred by the private sector caused by their cease-in operations. I am sure that, like you, or like me, you've gotten emails and calls from individuals. I've been contacted by two of the mayors of the small cities in our county, indicating frustration that we are back to this issue again. The theme that reoccurs in my inbox is to stay in our lane and to allow the governor to exercise her discretion with regard to the final execution of a stay-in-place order. My question to legislators has been, what do we think the difference would be in people's day-to-day activities with a stay-in-place order? And the reality is that they don't expect activities to change. It is a communication tool. And then that opens up multiple levels of enforcement and determination of essential services and so forth, and ripple effects that supervisors are not in a place to judge. That's the decision of the governor. So I don't support taking any further action on this. And I also would like to say to my colleagues that I would, for purposes of moving on to the many other immediate and emerging things, I would like to have this issue be behind us. That until the governor takes some kind of a direction and says to the counties, specifically counties or municipalities, I wish you to do this, I think we should let this issue be completed and be done. And that this is, we're going to conclude this conversation today and that it won't come back for a third time.
I will comment regarding the towns. In the draft that was put forward, the towns would have had the ability to opt out of that. So I think their lane was respected, but I agree. I think we need to put this behind us. I think part of the confusion was, it was just a couple weeks ago that the governor herself stated that she believed that cities and counties had the right to do this. And then the state Attorney General's opinion came through and that modified that. So however we got here, and I agree, I would like to put this behind us at this time until such time as the governor either okays counties and cities doing their own thing, or she does it at the state level. I think I am in agreement that it's her call, and again, I'm not wanting to have a legal argument with our own county attorney, and I would I believe with the discussion that we don't have a majority or consensus to move forward on this.
So some of my closing comments would be, I'm not interested in hiding behind a legal opinion or hiding behind the governor. I'm acting in the best interest of Dubuque County residents. I think our scenario is unique throughout Iowa. And if the governor is not going to do it, a statewide order, at least she gives us the authority to act on behalf of our local citizens as we feel fit as local elected officials. My last comment would be I'll make a motion to continue to pursue the active stay-at-home state through resolution or ordinance.
Okay, there is a motion, and I believe the motion is proper because it is on our agenda as an agenda item. There is a motion to move forward with the Dubuque County shelter-in-place proposal. Is there a second? I'm going to rule that there's no second, so the motion dies for lack of a second.
I'll make a motion that we formally deny this resolution and that we conclude the discussion about the stay-in-place orders coming from the Board of Supervisors.
Motion dies for lack of a second. My comment is we did not have a finished document, so I don't think your motion was in order, and I think we've already acted on that, so I think we'll move forward. As far as I'm concerned, it's done, but I had spent several hours on Monday after the meeting researching Illinois, Wisconsin, other states about essential activities and all that. I believe that's all moot at this point. And Supervisor Wickham's motion failed. I think that takes care of it. So we'll move on the agenda. We have item B. We have a Community Foundation funding request that is in your packet, and I'd ask that that be put up. Thank you, Dawn. Okay, and why don't we have, let's unmute Nancy Van Milligan and have her talk about the request and the need for additional funding.
Thank you, Dave. Nancy Van Milligan from the Community Foundation, and we hold the Disaster Recovery Fund, which is a community fund with partners, Urgency Management, United Way. Our committee consists of United Way, VNA, Catholic Charities, Community Foundation, Doug Horseman from Dubuque Initiatives, who they have given $100,000, and Mike Donahue from the DRA. Both of them also serve on the committee. To date, we've received 36 applications for a total of $588,000 in requests. As of yesterday, we had more requests than we have committed dollars, which is $566,000. We have funded $302,000 so far. The committee meets twice a week. Typically, we get a grant, we research the grant, we often table it till the next weekly meeting. We are currently limiting all of the funding to basic needs, so we are funding a lot of food, but also shelter, health, safety, and cleaning supplies are the bulk of the asks. We have given some significant grants to specifically Catholic Charities, Food Pantry, Dream Center, Rooted, Dubuque Area Labor Harvest. And most of it is a 4 to 6 week funding stream that is going to allow them to continue to feed the people in the most need. We are doing research on systems. So rather than just fund an individual child care center, we stepped back and researched the whole child care system. We're able to partner with the school district and provide the cleaning supplies, worked with a couple of partners, and we are getting every one of them a no-touch thermometer, and none of this is hitting the fund. So we are, when the grants come in, we want to make sure that we are filling gaps that federal and state dollars aren't funding, and or that there aren't other resources in our community that can handle them. We are currently doing a very deep dive and researching the food system. We have a concern that we are going to be feeding families for a long period of time, and making sure that we understand what are the resources out there, what are the funding streams, when do they stop, where are the dollars going, how many people are we feeding at each center, and that we are doing this in a very efficient and effective way. We have requested another $200,000 in funding so that we can continue to make sure that those basic needs are being met. But also want to assure you that we are looking for other sources and working to try to get private donors to step forward. This is a very scary time for people. The stock market is down. They're worried about their own families. And I will share that the normal reaction that we get from the community when there's a disaster is not as robust. And I think we can all step back and understand why that's so, but we will continue to work on that. I guess the only other thing I would share is we are currently not granting any funding around lost wages or hazard pays, et cetera, and are continuing to look at the federal government stimulus plans to help with that. We are also not funding pets and pet food, but we are reaching out to private donors that we know that are passionate about these needs to make sure that the Humane Society and others that pets are being fed. But we are using, at the current time, are restricting the fund to a human response. I'll take any questions if you have them.
Nancy, this is Supervisor McDonough. I have a couple questions for you. At the Cracker Barrel on Saturday, I don't recall which of our legislative team, but they indicated that there was the ability for counties to be applying to the state emergency fund to be pulling down significant dollars, that there were millions of dollars left intentionally at the state level when they rapidly convened for their to shelter back in their own community when they disbanded for the interim. And so I'm wondering how are you working with those individuals to understand what is untapped at the state level? We've contributed $200,000 at the county level to the disaster recovery fund, which makes us by far the largest donor to the fund, and I mean by significantly so. And so feeling like we stand apart in that regard, I would, citizens are commenting and asking me about, there's got to be something bigger than the County Board of Supervisors to fund the disaster recovery fund. So, we need to look big and beyond the county to go back up to the state to be sure we're taking advantage of those millions of dollars that the legislators have indicated are available to us somehow. I also need to have, I have a specific question about what was funded with Catholic Charities. I think they have $35,000 in funding that you've allocated there. And then I don't know what that piece would be. And then another, I guess, narrative question I would like to have you answer is, how are we addressing the needs beyond the city of Dubuque? The county has, with ECIA, has submitted a grant request for community block funds to do meal delivery and meals outside of the city of Dubuque. And if that comes through, we're looking at $370,000. So that's a big piece, $370,000. So if we are, how is that money that we've given you being spent countywide in a countywide response? And then also, what is if we don't do this, where are you going to get the funding? I mean, I guess we have to look at worst case scenario. to see what it is we can do that we can actually participate in.
I'd be happy to answer those questions. It occurs to me that these state emergency funds, the county themselves would have to apply for those. We would be happy to help distribute them. I think the one thing that we are providing the county is doing a coordinated response and doing the research behind who's doing what and the systems that are serving our county. So I don't know how we could help with that, but if there's a way, we'd be happy to, and we would certainly be happy to distribute that. Am I missing something there on that question, Ann? I'm not sure what our role would be there.
Well, I guess I was looking to see if you were aware that that money even existed. You know, you were, yes or no?
I was not. No,
Okay.
I did not understand that.
Right. And so I guess, Chuck Eisenhardt's chatting now and adding in, maybe I could just read this and then we'll both be better informed. The governor has authority to move dollars around in the current state budget and to spend from economic emergency fund. If local governments have needs that the state should be helping with, the governor would need a specific ask to act on. So maybe we will start that conversation here, but that was news to me on Saturday, learning that the state has some money there. So we'll work on how we can access that to replenish and to pull those funds down for our entire county. In terms of meals or aid beyond the city of Dubuque, other than the vetting of programs, are we doing anything that people could see it actually be present? And the food banks that have been created, the food pantries, is that at the result of this fund?
Yes, we are funding throughout the county. We have funded the food pantries. We are working with Resources Unite. We are making sure if there are gaps in geographic regions and have identified those and got dollars out of those. And Catholic Charities also works statewide, and maybe it's time to bring them into the picture. Catholic Charities is a referral for many of our nonprofits, that if they have a client that comes to them that needs funding, like rent or food or whatever, a lot of that is going through Catholic Charities, who does case management, and then it's getting dollars out to those people. For instance, we had a conversation with Presentation Lantern yesterday. They do not have the capacity to be a back office, to be calling landlords, to be connecting people with specific resources, and Catholic Charities serves as that case manager in many of those cases. That is why they received $25,000. Our other big funded groups have been the food pantry, and we will continue to fund them. And we think we've worked out a partnership with the Boy Scouts come May to do a food drive that would be safe. The food pantry is down 22,000 pounds in food, a lot because the Boy Scouts were not able to do the food drive. The Dream Center and Rooted, who are both serving large numbers of families in our neighborhoods every day. Dream Center received 26,000, Rooted received 33. Dubuque Area Labor Harvest received 10. So we are feeding a lot of people throughout the county through our partners.
And some of these same folks would have been part of that block grant application that ECIA also put forth, Labor Harvest and Project Rooted. Some of those folks as well standing up and saying that they're going to be doing many more meal deliveries to seniors and to students and folks out in the county. So that just isn't in place yet because I think we're waiting. I mean, it's not deeply in place through our funding because we're waiting for determination on our grant requests.
I actually think it is deeply rooted in the county, and I will reach out to Kelly at ECIA to see how we can better communicate and partner on this. I think to have one coordinated fund is very important. We do not benefit from this, but to have where we are actually looking at what is the whole food system, who are the the hungry people and who are the providers, and be able to create a coordinated response is going to be important. And whether it's in partnership with the ECIA or if that we do the funding, we can figure that out. But currently, we are requesting $200,000 so we can continue to accept grants and distribute funds.
And if we don't act, then what happens? Or if we deny your request, what happens next?
Well, there will be less money to distribute, and there will be a gap in people's ability over time. I think, as I said, we've got 4 to 6 weeks of funding out to many of these funders. We're receiving applications every day and doing more research of where needs are. So we will continue to try to fundraise, but I'm sorry, I can't hear.
I don't know who's speaking other than you and I.
Okay, someone came across my feed. So
I heard it as well.
We will continue to fundraise. The county has capacity where a lot of other organizations right now do not.
This is Dave.
We will
Baker.
be going to.
Go ahead, Nancy.
Hello, Dave. No, go ahead.
All right. This is Dave Baker. I appreciate Supervisor McDonough's input and questions about whether the food is getting out to folks in the county. I mean, first of all, there are times I have to remind folks that the city of Dubuque lies in Dubuque County and is about 2/3 of the population. But I will say this, as an active volunteer, the Dubuque Area Labor Harvest is delivering groceries, and I have been helping with that with a lot of other really good volunteers. And I would say it's on a proportionate basis for the deliveries that I've had for those that are outside of the city of Dubuque, if that's the concern, versus inside the city of Dubuque. In other words, I think a majority are in the city of Dubuque, which has about 2/3 of the population. But I have had numerous deliveries outside of the city of Dubuque. And so I can only speak for that organization, but if that's what the question is. The other point I'd like to make is I don't know if we've received the CDBG funding yet. I think it's pretty common knowledge that local government is more nimble, closer to the citizens than state or federal government, and able to act quicker. So I am not wanting to hold up getting food out to people. So I will be supporting this request.
I'd like to share one other thing. We are getting out into the county, but the other thing that we encourage, if there's needs out there, that people put in an application and ask for support. The other thing we're noticing, and it's the one reason I've worked with the Boy Scouts, is many of our smaller communities have had the capacity to do food drives safely. Cascade would be a great example, and we did give a grant to their food pantry, and we are in contact with these pantries and asking if they have needs. But that's what inspired us to work with the Boy Scouts to figure out how do we do that in a larger population safely. So we are absolutely open to taking applications from the county. We are talking to the small communities and are open to doing more funding as needed.
Okay.
So, this is Supervisor Wickham. Chair, if you could recognize Josh Jasper, I'd be interested in his just take on what he's witnessing and experiencing through Resources Unite, and then obviously through our general assistance program. Just a general commentary on the need and the services that he sees both in the city of Dubuque and surrounding communities.
Okay. Dawn, can we unmute Josh? Go ahead, Josh.
Thank you. I guess I would just briefly echo what Nancy said in regards to the need for food specifically within the city, but also within the county. I think there's two important pieces that we at the 30,000 feet have to be mindful of. Number one, in the last 3 weeks, Resources United has opened up 5 new food pantries in the county, and we will be very soon applying to the Community Foundation within this fund, again, needing help to sustain those pantries. You look at like Balltown, for example, population 67, they've already delivered and served 45 families over the course of the last 2 weeks, and that's 67 people in a very small town. And so, you know, we're seeing that throughout the county, and we're needing help to get more food out there. The other piece that I think is really important for us to think about, and this is above my pay grade, is accessibility. And what I mean by that is we have other food pantries in our county that have been operating for a long time, which is fantastic. But they've been operating as most food pantries do, where it's, for example, they're open on Tuesday evenings between 5 and 7, and then all other days and all other hours are appointment only. When you specifically look at more of our marginalized communities or people within those communities, we need to do a better job of outreach. So for example, you think of like Cascade, which has a booming population of Hispanics, or in Dyersville, for example, those are great pantries. And just last Tuesday night, there was a pop-up that we've helped start in Cascade for a food pantry. But I guess I would just want us to think more about how are we going to be more creative and proactive to getting food to people, much like the point in regards to the masks earlier. There's a lot of people that need masks, and even putting them at meal sites isn't going to be enough. We have to think about how we're going to get to this conversation, food to the people, not only within the city, but in these communities in which, quite frankly, there's still a lot of distrust. There's a lot of relationships that need to be built, and people aren't just going to wake up tomorrow and roll into one of these food pantries without some concerted effort.
Nancy, can you tell me, has the city of Dubuque contributed as a municipality to the fund? That's a
no, they
question
have
that I have. They have
no,
not.
they have not.
Okay. And do you have pending requests with them?
No.
Okay.
I don't have a formal request into them, no.
I think for me, the number is that it was $200,000, and I think that was, maybe Stella can help me, but I think that was, what, 2 weeks ago? Oh, let's see here. It was in March 18th is the date that allotment was made. At this time, I am going to make a motion that we approve the request for $200,000 to the Community Foundation to contribute to our second major dose to the Disaster Recovery Fund.
I will second that.
Okay, motion made and seconded to approve the request for $200,000, and we're open for discussion.
In discussion point, I would ask Nancy to perhaps talk with the Cascade Pioneer and the Dyersville Commercial, the folks that are out to help spread the message that we are, or we, in contributing specifically to this disaster fund, are following that level-headed approach that was designed prior to the pandemic of trying to get funding out to meet basic needs. And I'm not sure that story is running in those other communities. Folks are saying, well, you didn't give us any money for food pantry items, in Worthington. Well, I don't know specifically whether that money directly went to Worthington's shelf. I don't know that, but I know that the person at the control center about this is the Community Foundation through prior agreement, that this is how the system would operate. And so in my support for this, it is that it has to go out system-wide, and I do think that you are the leadership position to make that happen.
Thank you, and happy to do that. And as soon as we accomplish this needs assessment and have this mapped, we will share that with you. And we are making sure, for instance, that the school districts are stepping up and using their free and reduced lunch money for this, which we are seeing that happen, but talking to them about what is the timeline for that? When does that run out? How much is it? So we're really going deep and looking at where the dollars are now and where they will continue to come from. And we'll be happy to make sure that people are aware to reach out to us if they need support.
I guess my final comment would be that I would ask that we have an agenda item at our next meeting where we do specifically look at, from the supervisor's perspective, about where is the funding, what are our reserve accounts look like, that we once again go back and visit the budget in depth so that we're assuring our population that we have the adequate reserves to strategically make these decisions, and that we're not just spending in a chaotic manner. We want to be sure that we're doing it with purpose and also with accountability. And I appreciate very much, Nancy, that your second page shows the allocations that you've made. There's a full listing. And then also, I know just in this morning's Telegraph Herald, you had issued another release updating yet more grants that were made. So I appreciate that kind of transparency.
And we did release 4 more grants this morning. So the need continues to increase, and thank you for your support.
Okay, any other comments? All in favor of the motion signify by saying aye.
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 Aye, carried 3-0. Thank you, Nancy.
Thank you, Nancy. Thank you.
All right, next item on the agenda, item 3C. UCC, which is Urban County Coalition CARES Act memo. I will defer to Dawn Sherman on this.
Yep, so we're looking at a motion to authorize you to sign this memo. We discussed this briefly the other day, that the Urban County Coalition is gathering data to eventually share with the executive branch at the state level to pursue the in efforts for the county to receive funds, federal funds, for any lost revenue that is directly related to the COVID crisis. So we've identified 2 so far, and we'll continue to update this and update UCC as they compile this. But we've included what our estimates would be for gaming revenue loss, and also in our conservation department with programming and rentals and facilities not available to the public. They are recognizing some revenue loss as well. So we are looking for just a motion for you to approve this, and we will send this off to UCC and continue to keep them updated as they communicate at the state level.
Make a motion to approve.
There's a motion.
And I will second that.
Approve the resolution with a second. Just in discussion, and I know Budget Director Stella Rundy is on, and again, this is for the benefit of the public. We are tracking. This particular item is revenue loss, but we are tracking on the expense side for the COVID-19 pandemic emergency, and at some point we'll be requesting reimbursement from FEMA for those expenses. Is that correct, Stella?
So we have set up separate accounts with specific project codes to track all of our COVID-19 expenditures. We had a discussion earlier in the week talking about the FEMA reimbursement, and we're working on getting some grant applications started on that. I will point out, Tom Berger said typically these work with a 75% federal government reimbursement and 10% state. So it's not 100% reimbursable, typically under these disaster grants, but we are tracking everything in specific accounts.
Okay, thank you, Stella. The exception to
that
that would be the CDBG monies that
Correct.
My understanding,
Yep.
there was no matching required from the county for that pool of money?
That's correct. So that's a state program, and that was no matching on that one.
Okay, thank you.
Yes.
Other comments? or
My comment would be,
questions?
my understanding is from the stimulus package that was released from the federal government that any community under 500,000 in population, which all of the state of Iowa would qualify, obviously including Dubuque County, would be administered through the state of Iowa. And so the state of Iowa will be the administrator of any stimulus money that comes from the federal government related to COVID-19 for the funds, basically for the $3 trillion that was just appropriated a week or so ago. So now that we're behind the governor, hopefully she'll be behind us on the expenditures as well.
Okay, we do have motion made and seconded. All in favor signify by saying aye.
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 Aye, carried 3-0. All right. We have a quick, we have a resolution to approve a final plat, Hoffman Acres number 2, section 20, Mo Salem Township. I'm assuming we have Tammy Henry on. And Tammy, you are unmuted if you want to take over.
Okay. This is Hoffman Acres number 2. It's a final plat. The property is owned by Ronald and Karen Hoffman, and it's located 2.44 miles east of the city of Dubuque along Schuler Heights Road. It has a total of 5.91 acres surveyed. The property is zoned R1 rural residential, and the purpose of this plat is to separate a lot out to sell to their son. The survey creates 2 lots. Lot 1 is a total of 1.18 acres, and it will be sold to their son. Lot 2 is a total of 4.73 acres with a farm building, and it will remain in current ownership and use. Lot 1 has an approved residential entrance, permit number 19-62 off of Schuler Heights Road, and Lot 2 will use an existing 30-foot wide easement off of Schuler Heights Road. There were no additions or corrections required for this plat, and the mortgage holder's acknowledgement is signed and attached, and some of the signatures are 60 days old, and they include the surveyor, December 18th of 2019, county assessor, December 18th of 2019, county board of health, December 18th of 2019, county engineer, December 23rd of 2019, and county planning and zoning, December 21st of 2020. This plat's been reviewed by myself as the plats officer, and it has all the required signatures. I respectfully recommend approval. This is just a simple division in a residentially zoned area, and as I explained, the son is looking to build a house.
I'll make a motion to approve the plat as presented.
Second.
Okay. Motion was made and seconded to approve the plat as presented. Any discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. I am going to circle back. I wanted to, we have Ed Raber is participating in the meeting. He joined our team on Monday, and I wanted to get a report from Ed and allow him to have some input. So I think we're going back to agenda item number 2. We kind of jumped out of order early, but we'll let Ed Raber have, if we can unmute Ed. And Ed, you can give your report.
I'm unmuted. Can you hear me? Somebody nod.
I can hear you.
Excellent. Thank you, Supervisor Baker. I'm Ed Raber. I've the last 2 days have been responding to the things that happened at our meeting on Monday. I've also been working on a couple of issues that were brought up there. One about reaching out to the long-term care facilities to see if there's an opportunity to directly communicate with them, hear from them, see what gaps they have and how the county can assist with that. That is a process. They get together weekly. I will not be a part of that, but representative, a liaison from the imminent incident management team will be meeting with them, and I'll be asking them to relay some of your concerns and your thoughts onto that group, and we'll await that feedback and a report for you on Monday. Also, have spent some time in light of the county attorney's opinion of looking at some other things that the county might do regarding messaging. I've been in communication with Patrice and Tom, and as well as other members of the communications team like Randy Gale, and they provided some great feedback. I think over what I heard and was sort of deliberating and investigating yesterday, I appreciate the Board of Health's comments today. They provided some, as well as staff from Patrice and Tom, and the supervisors provided some strong language about what the actions are necessary right now. And so if that's what the board wants, I would assist the Board of Health and the staff to begin working diligently on that and get some action going. So if that's, I'm not sure you need a motion, but just to make sure that I'm understanding what the Board of Supervisors would want, I think leaning in hard on that to support what the volunteers and staff are doing and helping to take a leadership role there is what I would do.
I think that's a good idea, Ed, but I would like you to work with the people who are stepping up to be the leaders of those subcommittees. So yes. Take direction from, obviously Patrice and Tom Beschen as chair, but looking at the Dianes and Susie Stroud. So the folks that are going to be trying to make those specific things happen, I would want them to be center point in what the communication need is.
And those action things. So I've already been in communication with Susie, and I will do that.
Yeah, and I think you're on the right track. As I stated, you started on Monday. I didn't expect that today you be having any earth-shaking news for us, but appreciate that you're working and gathering information and looking to work with the Board of Health members and subcommittees. And I would ask, I assume Patrice is still on? Maybe not. I would, I guess, ask as far as like the long-term care facilities go, I think my opinion is that the public wants to hear what steps are being taken, that they have confidence in the providing safety net for the residents and the employees, and that the incident response team be open to having you listening to your ideas. So I would be disappointed if they were slamming the door shut. Hopefully that's not the case.
Thank you, Supervisor Baker.
Okay, Supervisors McDonough or Wickham, anything for Ed Raber?
Not at this time.
Okay.
Thank you, Ed.
All right, unless there's something else from one of the supervisors, our next meeting, we're looking for an adjournment until Monday, and that agenda I think is being developed. We'll have the 9:30 a.m. meeting, 9 o'clock, I'm sorry. 9 a.m. meeting of the Board of Supervisors. Does it look like we're going to be having a county engineer's report prior to that?
Yes, Anthony will be in, I believe at 8:15.
Okay.
So I'm looking at having this joint COVID work session meeting starting at 10, and our agenda doesn't look too full, so I think we'll be able to meet that. If not, we can recess your regular meeting and then go back in after this meeting ends.
Okay, sounds like a reasonable plan. All right,
make a
entertain a motion
recess
to
till
adjourn
Monday.
until Monday.
Sorry, to adjourn until Monday.
Second.
Motion made and seconded to adjourn. All in favor signify by saying aye.
Aye.
Aye. Carried 3-0. Thank you, everyone.
Thank you, everyone. Appreciate it.